Welcome to Healthy Living. I'm Lori Johnson. Thanks for tuning in today. We're talking about the latest with the COVID-19 pandemic and the dramatic changes we've seen recently. My guest today is Dr. Jonathan Baktari, who is a pulmonology and critical care expert as well as a vaccine specialist. Dr. Baktari, thank you so much for being here today. Good to see you.
Thank you for having me, Lori.
So we've seen recently so many different changes. Probably the most dramatic one is when the CDC announced that even vaccinated people should put their masks back on when in public places indoors in many areas in the country. And, some of the other things that we've seen, vaccine mandates, and it all seems to stem from one thing: the Delta variant. Can you talk about this Delta variant? A lot of people don't understand. Everything seemed so good a couple months ago. What's happening here?
Yeah, Lori, I think the Delta variant, is one of the major reasons the CDC is making these changes, and mainly because the Delta variant appears to be number one, more infectious. So like if a person gets the Delta variant, instead of infecting 2.5 people, they may infect 4 or 5 people because the viral load is bigger, meaning you have more copies of it when you get infected. And so for that reason, it's essentially more sticky or more infectious.
So talk about why this is of particular concern to vaccinated people. I mean, people such as myself who got the Pfizer vaccine. I was told that it was 95% effective at preventing disease, infection, and Moderna around 94, and J&J also very high. And we've seen people who are vaccinated not have any infection at all. So why this concern now among vaccinated people?
Well, the data you mentioned is still holding up from what we can see that, the current crop of vaccines approved in the U.S. are probably, after you get 2 doses of the Moderna and Pfizer, for example, will protect you, 90-95% against the virus, and it will, 99% prevent severe hospitalization and death. So the numbers are still holding up. I think the issue really is on the people that do get breakthrough cases. Will they potentially infect unvaccinated people? So I think a lot of this is a reflection not only of the Delta variant, but of the less than expected vaccination rates that we're getting in the United States. Only 50% of the population is vaccinated with 2 doses currently. So I think it's lower than we thought it would be at this point.
So can you talk about how problematic that is? A lot of people who aren't vaccinated say, well, hey, I'm young, I'm healthy. If I get the virus, I'll probably be just fine. And we see that there are very low numbers of vaccination among the young people. What can you say that would encourage people who have been holding off to change their minds?
Yeah, I think the biggest thing is look at who's dying and getting hospitalized right now. The people who are dying and getting hospitalized are unvaccinated people. So I think that should be in and of itself a reason to give up on vaccine hesitancy. And I think the other major reason is people always said, I don't want to get a vaccine because there was not a large enough study before the vaccine was rolled out. And that argument goes away because even if that's true, we've now done the world's largest study looking at the safety of these vaccines by giving out 350 million doses in the U.S. So I think that logic goes away. So there's no more reason to be hesitant because there was not a large enough study before the vaccine was rolled out.
Well, some people say that they're waiting until the vaccine receives full approval from the FDA. Right now, it's still under emergency use authorization, and some people feel like it's still experimental until the FDA does give it that final approval. When do you think that's going to happen, and why is it taking the FDA so long?
Well, normally the FDA, gives full approval after 3, 4, or 5 years of studying of vaccines. But really, I would again make the argument that even when vaccines get full approval, they don't have a study that included 350 350 million doses. So on some level, I know this is semantics. This is better than approval because we've actually rolled it out and given 350 million doses. No vaccine that got approved had that many vaccines given before they got approval. So in many ways, we're beyond getting approved because we got it approved in real life, as it were.
So what do you think it's going to take to bring this pandemic to a close? A couple months ago, there were a few days when we got below 100 deaths per day.
Right.
And a couple days we dipped, right around the 10,000 case mark, which was so great to see. It was going down, down, down. And now we're up around 62,000 cases a day and really getting close to 300 deaths a day. We're absolutely going in the wrong direction. What do you think it's going to take to turn this ship around?
Yeah, I think it's going to be world vaccination rates because look at the Delta variant. Where did the Delta variant come and when did it come? It came from India at a time when India, was being ravaged by the virus, having 400,000 cases a day, probably more. And when the virus can replicate that much, remember, it creates 1 million copies potentially in every one person. So if you have 400,000 cases, that's a lot of viral replication, allowing for mutations, natural mutations to occur, and then the genie gets out of the can, and it allows a variant that can evade some of our normal immune systems. So I think getting the world vaccinated is really the answer, because we're going to have more variants if only 20% of the world is vaccinated. That's like 80% not vaccinated, and they're getting the virus and replicating it.
Well, explain that, because a lot of folks, regular folks really don't understand this whole idea behind variants, mutations, strains, the viruses, and how do they develop? I mean, how can we stop these awful variants? Because who knows what's coming down the pike? We've heard that there's a Gamma and a Lambda variant out there, and they could even be worse than Delta. Talk about how these variants develop and what we can do to control them.
Right. So, the example I give, for example, is any one person infected probably makes 1 billion copies of the virus inside of them before they get better. So imagine if you were baking a million cakes over and over with the same recipe. Sooner or later, you'd make a mistake. Now, majority of those mistakes doesn't infect the taste of the cake, but eventually you'll make a mistake that does make a significant difference. And that's what these variants are. 99% of all the mistakes that occur when virus replicates leads to nothing. Once in a while, the virus replicates, makes a mistake, and that mistake makes the virus more contagious. It allows it to bind better to the next victim. And that's why we need to stop viral replication and more cases.
And the way to stop viral replication in more cases is really just to slow down the spread, right?
Slow down the spread, but if we could snap our finger and give the whole world a vaccine tomorrow, that would make a huge dent in variants coming along.
Mm-hmm, mm-hmm. So with this Delta variant, we've seen with other variants, they kind of rise and then they fall. They get to a peak and then they go away. Where do you think we are with this Delta variant? When do you think it's going to be out of our country?
Well, it's actually the Delta variant is taking the reverse. Every 2 weeks, it doubles in terms of the percentage of cases. In England, it's already now 90%, and eventually will be 90, 100%. It's already 80% of the cases in the U.S. So it is now the dominant strain, and so that's where we're going to have to deal with. So I think what you're going to see with boosters, if and when they're approved, actually boosters specifically targeting now the Delta variant as well as the older variants. So sort of multivalent boosters, like we have multivalent flu vaccines where it addresses multiple strains with one shot. I think that's the direction we're probably going to go in the next 6 to 12 months. You'll see boosters, and you'll probably see boosters that include these variants, exactly like we do with the flu shot, where we house 3 or 4 variants or strains in one shot, and you get it.
This is fascinating information. We're going to take a quick break and be right back with Dr. Jonathan Baktari and talk more about possible boosters for COVID-19. Stay with us.
On October 1st, 1961, history was made when a tiny station began transmitting the first signals of the Christian Broadcasting Network.
CBN, the Christian Broadcasting Network.
And now, a new era has begun with the all-new CBN News Channel.
Just moments ago, the Iron Dome intercepted an incoming rocket right on the Gaza border.
In ministering in this area, spiritual warfare is definitely involved.
A 24/7 news network, bringing you the news you want from a source you can trust.
In Kenya, 40% of the medical services are actually provided by these Christian hospitals.
Let's talk about the economy.
Believers here are joining together to win people to Jesus Christ.
All your favorite shows now in one place. Go to cbnnewschannel.com to find out how to get the CBN News Channel on your TV all day, every day. CBN News. Life is better with a good night's sleep. Get your free DVD or booklet of Protect Your Sleep today.
Life. It's meant to be lived fully. Jesus said it. I came to give you life. Life to the fullest. Life in your family. Life in your finances. Life in your body, mind, and spirit. Life in your everyday. At CBN.com, we're taking what Jesus said seriously. We're here to help you discover life. Life. Live it fully. CBN.com.
Stay connected with CBN News all day across our platforms.
Welcome back to Healthy Living. And my guest today is Dr. Jonathan Baktari, who is a vaccine expert. Dr. Baktari, just before the break, you were talking about booster shots, and it's very interesting. We're hearing about two different types of booster shots, more of the same that we've already had, and then a different type of shot that's more directly targeted towards different strains of the virus. Let's talk about the first. We know in Israel that they have already started giving a third Pfizer booster to their most vulnerable people. So this is the same vaccine that was given twice before to them. And it looks like there's some research that shows that the antibodies do tend to fade a little bit after about 7 months. What can you tell us about that?
Yeah, I mean, we already know that some of these variants, will eventually need boosters because, like you suggested, the antibody levels will drop in time, and some are not optimal for these variants. So we know in the vaccine world, there are certain type of viruses where you get a series of shots and you're good for life, like measles, for example, or hepatitis A and B. And then there are other viruses that you will constantly need boosters, like, tetanus shot, where you get a booster every 5 to 10 years. And I think this virus has already shown itself that it's more than likely going to need a booster. I think right now we're hesitant to talk about it because we're so focused on getting more people to get the first 2 doses, and we don't want to take our eye off the ball on that. But yeah, I think coming down the pike, the booster is very, very likely to occur.
So, 7 months ago, for example, the people who were getting booster shots were some of our most vulnerable. I know my mother, who's quite elderly and has a lot of comorbidities. She was one of the first ones to get it. So honestly, I wouldn't mind if she got a third Pfizer anytime soon to keep her antibody level up. But it's not really recommended here in the U.S., is it?
Well, I think it's not recommended, not because it wouldn't be optimal. It's just, from a public health point of view, do you want to start a whole third shot campaign right now when we're behind what we were expecting in terms of the current vaccination rates for the two? In other words, if you have limited time and resource on a campaign, I think the goal would be to get more people to get the first 2 as opposed to shoring up people with the third. But yes, in a perfect world where there was infinite time and resource and energy, people should probably get the third dose. Certainly there's no harm in it. We know that from the vaccine world. If you've tolerated the first 2 doses, there's almost no chance you'll have a side effect to a third dose, and definitely your antibody levels will go up. So in a perfect world, yes, everyone should probably get a third dose. In a strategic public health point of view, you have to say we have a limited amount of time, resources, energy, public health resources. So should we focus on, going from 50% to 60%, or should we focus on giving people their third dose? And even if you offer people the third dose, out of the 50% of the country who's gotten it, how many people would agree to get a third dose? And so now you'd have vaccine hesitancy for the booster. And so that creates a whole new set of problems.
Seems like it should be optional because there are some of us who really want it. And so not hesitant at all, but actually really would like it.
There's also an equity kind of thing somewhere in the back of public health officials. When the rest of the world hasn't gotten the first 2 doses, I think there's sort of like an equity thing about maybe, rolling out a third dose and so that might also be a small factor.
Right. Well, then let's talk about the other booster you were discussing, which, as you said, was sort of like what we do every year with the flu vaccine, which is kind of change the vaccine itself and target it more towards the latest variants, in this case, the Delta variant, so that it has a higher efficacy. Where are we with that?
Yeah, that's amazing. Part of that has to do with the mRNA technology. We probably couldn't have done it that fast before. But what mRNA technology does with the Pfizer and Moderna is allows them literally in a matter of weeks to create a new version of the vaccine. So I know both Moderna and Pfizer have suggested that they could easily do that, and I would not be at all surprised if that occurred. It's easy to do, and there's literally no harm in including multivalent vaccines, booster shots that could cover that. And we have the technology. It's just a matter of resources and diverting attention from one thing to another.
What type of clinical trials do the booster shots that are geared towards other variants do they have to go through? What kind of testing?
Well, that's interesting because, when a new flu shot comes out every year, they basically use their approval from the previous years, right? They don't go out and get a whole new approval every year when the new flu shot comes out. So I think I'm assuming the vaccine manufacturers like Pfizer and Moderna are probably going to want the same thing from the FDA, where basically it will piggyback on their or approval with slight modifications, sort of like what the flu shot gets. I'm sure that's what they're going to ask for. So we have to see how the FDA responds to that. But I would imagine that would be sort of, given that it's a pandemic, the most optimal thing to do to piggyback on the previous approval.
Well, that would certainly save a lot of time. And as you pointed out, the mRNA vaccines also are real time savers as far as making new ones. We're going to take another quick break and talk more about the latest with this COVID-19 pandemic with expert Dr. Jonathan Baktari right after this. Stay tuned.
Hey, if you're tired and exhausted all day, you can't think clearly, and you really just need a cup or even a pot of coffee to get through your day, then join me, Dr. Josh Axe, for this new series where I'm going to teach you how to transform your diet and use essential oils and supplements to get a better night's sleep.
Wake up to your best life. Call 1-800-700-7000 to get your free DVD or booklet of Protect Your Sleep today.
It's about the competition.
I kind of put that pressure on myself, and I think people had expectations.
It's about overcoming.
We use this phrase all the time, keep chopping, keep practicing hard.
It's about going the distance.
I think as a father, it's my job, to lead, just be the best husband and father I can be.
Watch Going the Distance with Sean Brown Saturday night at 7:30 on the CBN News Channel.
Or Orphans Promise is committed to loving and serving at-risk children, to helping keep families together, and to creating opportunities for strong and sustainable communities around the world. We're working in over 60 countries around the world, and with your help, we can do even more. There's an old African proverb I love that says, if you want to run fast, run alone. But if you want to run far, run together. At Orphans Promise, we want to run far so we can touch the lives of as many orphaned and vulnerable children as possible. But we don't want to go alone. We're out to change the world, one child, one family, one community at a time. Will you join us?
We're back now, continuing our discussion with Dr. Jonathan Baktari. Dr. Baktari, what is your opinion with schools? We've seen so much back and forth, and now the recommendation that everyone in schools be masked, including people who are vaccinated. But isn't the risk to children so very low, and isn't wearing masks such a hardship on those poor kids?
Yeah, I mean, now that the vaccine is approved for 12 and up, so I guess we can potentially, that would be a separate conversation where we have vaccinated 12, 13, 14-year-olds like in high school, whether they should be masked. But I think the masking is part of the extension of this, Delta variant concern where, the question is whether children who get the Delta variant, are they going to be more infectious than the old version? And that data isn't completely out, but the suggestion is they might be more contagious if you really believe that, every one person gets infected, infects not 2.5, but 3.5, 4.5, 5 other people. So I think, again, it's abundance of caution. My question has always been, especially in the younger children, whether they wear the mask properly anyway, meaning 5, 6, 7-year-olds, and whether they know anything about social distancing anyway. But that's a separate issue, whether it's even effective in the super young. And then above 12, they're going to be vaccinated. So I think there's a middle group. But the good news, by the way, is the vaccine manufacturers are doing trials, Pfizer, Moderna, and I think we're going to see some approval for 6 and above, potentially by October, November, and potentially 6 months and above by maybe January.
What's your opinion about vaccine mandates? We see that the VA hospital workers now have to have their shots. The federal government is probably going to mandate vaccines or have the weekly testing. We've seen it in California, New York City. What's your opinion about all that?
I really don't see what the controversy is, because we basically have been doing that already for every other vaccine, to get into school, to work at a hospital. You can't get a job in a hospital unless you've had, your chicken pox, your measles, hepatitis B. I mean, we've been doing this for certain sectors of the population. We're mandating. You can't get a job in healthcare or other industries until you've had your vaccine. So I don't think this is any different. And it's along the same lines, where it's for public health reasons to do a certain job or to do a certain thing. You can be mandated to get a vaccine because we've been doing it for decades.
Mm-hmm. And what about, do you think that will, when people are given the choice, a vaccine or weekly test, do you think that will improve the increase the number of people who opt to get a vaccine?
Yeah, I think so. I think, especially when the cost is deferred to them, which is some things that I've seen, when the cost is deferred to the employee or what have you. But hopefully the data that, so many people have now gotten the vaccine, and, people haven't grown 3 heads or something. I mean, which is all the original concern about infertility and all that. As all that goes away and you start mandating it, yeah, we should hopefully get to 60, 70%, 80% would be amazing. And also, as the vaccines get approved for children younger than 12, that's going to add to the population that can get it, so we can get closer to that magical herd immunity if possible.
All right. We're going to take one last break and be right back with more with Dr. Jonathan Baktari. Stay with us.
When I came to Regent University, it's like the world opened up. I felt like I needed to advance my career and go back to school. Regent was a perfect fit for me. The Regent professors are world class. You are equipped. The focus of the faculty is on each individual student, whether it's online or in person. You become a part of Regent's family. You carry with you not just the content and the knowledge, but the confidence to understand that we can be significant in the world.
Regent University. Follow your path.
Nigerian Christians are
Christians in Iran are routinely arrested.
Happily, Christians continue to suffer.
In times of trial and affliction, you need to know the truth.
One of the fastest growing Christian populations in the world.
Join Wendy Griffith and George Thomas for Christian World News.
Young people are the ones who are open to the gospel.
Powerful stories of suffering and hope that affect all Christians. Saturday night at 6 on the CBN News Channel. Get Protect Your Sleep and discover how to improve the quality of your life. A free DVD or booklet from the Christian Broadcasting Network.
If you're not a great sleeper, you can do things to make yourself a great sleeper. If you're already a pretty good sleeper, you can enhance your sleep and be even better.
5 leading experts help remove the obstacles between you and restorative sleep.
When you don't get a restful night's sleep, you wake up with an accumulation of stress.
Call 1-800-700-7000 or go to cbn.com to get your free DVD or booklet today.
Everything you do better with a good night's sleep.
You'll discover how food affects your sleep, how to put insomnia to rest, explore effective remedies for sleep apnea, and much more in Protect Your Sleep. Wake up to your best life and get Protect Your Sleep today. Call 1-800-700-7000 or go to cbn.com to get your free DVD or booklet.
Stay connected with CBN News all day across our platforms.
And welcome back. We're continuing our discussion with Dr. Jonathan Baktari. Dr. Baktari, when you were talking about mandated vaccines and how that may improve the vaccination rate, we did see over the weekend, the news about the Delta variant and its dangers appeared to be resonating with people. 800,000 people got their vaccines over the weekend, which is the highest we saw almost all summer. And yesterday was a big day with 500,000. Do you think that trend is going to continue?
Yeah, I think a lot of reason for vaccine hesitancy is starting to melt away. And I think when people read the news that almost 100% of people getting hospitalized and dying are the unvaccinated, I think that's got to resonate more and more every day.
Mm-hmm. Well, unfortunately, we are out of time. And I wanted to ask you, Dr. Baktari, where can our viewers find more information about you?
Yeah, they can go to BaktariMD.com. I'm also on LinkedIn, and of course, they can go to E7 Health. But yeah, the E7 Health or BaktariMD.com are good ways to get a hold of us.
Well, thank you so much for your time today and for your expertise. It was great to see you. Thanks for being here.
Thanks for having me.
And thanks to you viewers for tuning in to this edition of Healthy Living. I'm Lori Johnson. We'll see you again next time.